By applying either leg or foot compression, the SCD Express compression system has been clinically proven to be one of the most effective methods available to increase venous blood flow in the legs and thereby prevent deep vein thrombosis.
Well, DVT is running epidemic in the United States, but the problem is that the awareness level of DVT among the public is very low. And we have to get more DVT awareness among the public and among healthcare professionals, because pulmonary embolism, the ultimate bad result from a DVT, causes probably 100,000 deaths per year in the United States. These are more deaths than the combination of deaths from AIDS, breast cancer, and motor vehicle accidents per year. And DVT is usually preventable.
The American College of Chest Physicians has identified clinical and patient risk factors that predispose people to venous thromboembolism. Here are some of the most common. The Goldhaber-Tapson study highlights how seriously underutilized the prevention of DVT has been across the country.
Now, this is the largest registry that's ever been done prospectively of DVT. We enrolled a total of 5,451 patients and published our results in 2004 in the American Journal of Cardiology. What we found really shocked me, because almost half of the patients who developed a DVT while hospitalized had not received any prophylaxis whatsoever. No pharmacologic prophylaxis, no mechanical prophylaxis, nothing. And that's a big challenge for us ahead. We have to do better.
As awareness of DVT has grown, clinicians have sought prophylactic modalities that are efficacious, safe, and cost-effective. Increasingly, the medical community has turned to Kendall's TED anti-embolism stockings and SCD sequential compression system to address these needs. Your Kendall vascular therapy specialist can provide you with risk assessment procedure guidelines that identify patients into low, moderate, high, and highest risk categories for DVT based on their clinical risk factors. For patients at moderate, high, and highest risk for DVT, the SCD Express compression system provides transportable, battery-powered leg and foot compression continually with no known side effects. Studies have shown that pneumatic compression applied to the full leg in a sequential, gradient, and circumferential manner provides more complete emptying of the calf and thigh veins, where the large and potentially fatal emboli are likely to originate. The SCD Express system with vascular refill detection technology pneumatically applies circumferential compression to the leg sequentially, starting at the ankle, then the calf, and finally the thigh, while maintaining a pressure gradient throughout the cycle to provide unidirectional blood flow. This wave-like compression efficiently milks blood from the veins, preventing pooling or stasis. It is designed to provide full and equal compression of the leg, regardless of its size or shape. To meet the needs of varying venous refill times, Kendall developed vascular refill detection technology. Older pneumatic compression devices operate with an approximate 60-second vent cycle that allows all legs to refill with blood prior to the next compression. Then, in 2000, published clinical studies determined that individual venous refill times ranged from 24 to 60 seconds. Kendall's patented vascular refill detection automatically measures a patient's refill time and then customizes the compression cycle to match. This personalized compression has been proven to move significantly more blood over time, thereby reducing stasis and potential clot formation, regardless of patient position or vascular competency. The system automatically adjusts the cycle, requiring no nursing intervention. The SCD Express system provides tailored DVT prevention by milking the veins as completely as possible, as often as necessary, for every patient, in any setting. These features make the SCD system hemodynamically superior to virtually every other compression system on the market. A foot cuff is also available for use with the SCD Express system. The foot cuff inflates to empty the blood from the plexus of veins in the foot. Vascular refill detection technology ensures the plexus of veins refills between each compression cycle, thereby optimizing cycle timing. When appropriate, apply the SCD compression system as early as possible before the patient goes to surgery. Dr. Nicolaides and others have shown that up to 45% of clots form on the day of surgery. Postoperatively, continue compression until the patient is fully ambulatory. If a patient is out of bed, sitting in a chair, compression should be used. Studies indicate patients could be at risk for up to 6 weeks or more. Studies also indicate that the combination of TED anti-embolism stockings applied under SCD compression sleeves have resulted in further reduction of DVT. This is because the SCD system reduces stasis and stimulates fibrinolytic activity, while TED anti-embolism stockings help reduce venous distension. For highest-risk patients, these methods are often combined with an anticoagulant. The Kendall SCD system consists of 3 components: the SCD Express Model 9525 controller, the reusable connector tubing, and single patient-use disposable compression sleeves. The SCD Express controller provides the same proven technology and clinical benefits as the other SCD models currently used in hospitals throughout the country, but has been improved. The SCD Express controller is smaller, lightweight, and transportable. It offers customized compression and all-in-one leg and foot compression while assuring that the patient is receiving the clinically proven parameters, beginning with 45 millimeters of mercury compression for 11 seconds for legs and 130 millimeters of mercury compression for feet with up to 60 seconds decompression for adequate refilling and venous priming. The new, smaller controller is easy to carry and transport with a patient. The SCD Express controller is powered by a power cord or an integrated battery. Depending on the type of operation, leg or foot, the battery runs for a minimum of 6 to 8 hours and recharges in less than 8 hours. The controller can be placed on a table, on the floor, or hung conveniently on the side or end of the bed by the pre-attached bed mount. Battery power provides continual, uninterrupted protection when transporting a patient from the OR to recovery or whenever the patient is moved away from an electrical outlet. In the event that a clinician wants to use the system as an ambulatory device, an optional shoulder strap can be attached to the controller, and the power cord and bed mount can be detached. The SCD Express control panel is designed for simple operation. The clearly marked front panel provides a power-on standby button, 2 port configuration buttons, and battery charging status indicators. When turned on, the machine will beep and flash the LEDs while quickly performing a valve and pump test. Then the pump will begin the sleeve detection process. There are 2 port indicators on the front panel, labeled A for one limb and B for a second limb. Those indicators correspond with 2 tubing portals located on the back of the machine. The controller detects whether a patient is receiving unilateral or bilateral compression. If a leg sleeve is connected, the controller will begin providing optimum prophylaxis and each port indicator will be lit green. If a foot cuff is connected, the controller will prompt you to push the corresponding port configuration button by beeping and flashing the leg indicator red and the foot indicator green. Pushing the button turns on foot compression for that port and the foot indicator turns solid green. The controller then provides optimum prophylaxis for the foot. In case of an error, a red light indicator will alert you to which garment has a problem, A or B. Turn off the controller. Check the garment and tube connection to ensure they are properly connected. Turn the controller back on. If a problem persists, the triangular-shaped fault indicator will light up. In this case, send the controller to your biomedical equipment department. Detailed, easy-to-follow descriptions of all fault conditions are included in the operations manual. The battery charge indicator is located in the upper corner of the panel. This indicator is lit orange whenever the controller is plugged into a wall outlet. Next to the charge indicator are the battery status indicators. These battery status indicators light green during operation to show the charge level of the battery. The vascular refill indicator is the hourglass icon in the center of the panel. When the SCD Express system reaches the set pressure of 45 millimeters of mercury compression on each leg, or 130 millimeters of mercury compression on each foot, the system measures the refill time of the veins. After the initial measurement, the process automatically repeats every 30 minutes and requires no intervention by the nursing staff. The SCD Express sequential compression leg sleeves are single patient use, disposable, and 100% latex-free. The non-woven hydrophobic inner and outer liners are lightweight and soft for greater patient comfort. The sleeves come in two lengths, thigh length and knee length. It has been documented that 75% of fatal clots originate in the proximal veins. Studies indicate that thigh-length sleeves provide more complete protection, therefore they should be used whenever possible. Thigh and knee-length sleeves come in multiple sizes to accommodate different size patients. The medium size will be appropriate for most patients. A sterile thigh-length sleeve is available for use intraoperatively. Your Kendall vascular therapy specialist will supply you with sizing guidelines and show you how to measure your patients to ensure that the sleeves are fitted properly. For optimum patient safety, the SCD Express system continually monitors the pressure applied to the patient. When necessary, it automatically adjusts the pressure to ensure your patient receives the prescribed compression for either leg or foot garments. For leg sleeves, that optimal compression is 45 millimeters of mercury compression, regardless of application of the garment, any position changes, or any movement of the sleeve. After determining the appropriate size sleeves for your patient, remove the sleeves from the plastic bag. Included on the package are instructions for product use. Place the side of the sleeve with the printed instructions against the patient's leg. Position the sleeve so that the blue arrows printed on the sleeve are centered directly behind the patient's leg. Locate the knee placement indicator on the sleeve liner and position it under the knee. The opening protects against compression of the popliteal vessels that run close to the skin surface behind the knee. Beginning with the side without the hook tape, wrap the sleeve securely around the ankle, then the calf, attaching the hook edge securely to the sleeve. Repeat for the thigh. This three-flap closure customizes the fit to enhance patient comfort. The sleeve should fit securely but not too tightly. You should be able to insert 2 to 3 fingers beneath the sleeve at the knee region. Repeat the procedure for the second sleeve if bilateral compression is desired. Take care not to position the sleeve so that the tubing causes pressure points on the patient's limb. This may be particularly important in certain prone, kneeling, or side-lying positions. All SCD Express sleeves can be rotated with no reduction in efficacy. Next, plug the white sleeve connector into a mating connector on the tubing leading to the SCD controller. Make sure the tubing is not kinked or twisted. Align the arrows and push the white mating connectors together firmly. To uncouple the white connectors, firmly pull them apart. Connect the tubing to the controller by inserting the fitting into the portal on the back of the controller. The SCD Express controller has 2 ports to accommodate unilateral or bilateral compression. Once you've ensured the tubing is correctly attached to the SCD Express sleeves and the controller, press the On button on the front panel. The controller will begin prophylaxis. Kendall designed a new sleeve to provide additional patient compliance and cost savings to the hospital. The patented SCD Express Cambia sequential compression sleeve is a single patient application sleeve that offers a tear-away thigh portion. As risk levels for DVT and PE decrease and the patient becomes more ambulatory, a clinician can determine the appropriateness of removing the top thigh portion of the SCD Express Cambia sleeve. The remaining knee-length sleeve assures continued protection over the course of treatment. In order to tear away the thigh portion of the Cambia sleeve, first locate the thigh portion of the sleeve, the blue tubing, and the connector. Grasp the thigh tube quick disconnect with one hand and stabilize the connector with your other hand. Firmly twist, then pull the thigh tube quick disconnect to remove the thigh tubing from the connector. Pull the blue thigh tubing through the calf chamber tubing guide. A valve in the connector automatically ensures proper inflation of the other sleeve chambers. Next, unwrap the thigh portion of the sleeve. Locate the 2 perforated connections between the thigh and knee portions of the sleeve. With one hand, grasp the tab located on the thigh portion of the perforated connection between the thigh and knee sections of the sleeve. With the other hand, grasp the knee portion of the sleeve. Firmly tear along each perforation, removing the thigh portion of the sleeve. That portion can now be discarded. The SCD Express and SCD Express Cambia sleeves work with the SCD Express controller and are backward compatible with the SCD Response, SCD Sequel, and SCD 5325 controllers with a necessary tubing exchange. However, the soft sleeves, which are packaged in all white poly bags, are not compatible with the SCD Express controller. Speak to your Kendall representative for more information on backward compatibility. The SCD Express system offers not only leg but also foot compression. The SCD Express foot cuff was created to mimic the natural effects of walking and weight bearing on the blood circulation in the foot and legs. Connected to the SCD Express controller, the foot cuff uses slow compression to promote venous return, reducing stasis. The foot application also uses vascular refill detection to customize compression and maximize blood flow to the lower extremities. A comfort heel strap design increases patient comfort and compliance. Patients that will benefit from the SCD Express foot cuff include those who need DVT prophylaxis, enhanced circulation, or have acute or chronic edema or leg ulcers. The SCD Express foot cuff comes in two sizes, regular and large, and can be used on either the right or left foot. Once you have used the foot cuff size chart to choose the appropriate cuff to use, place the foot in the designated area of the foot cuff. Ensure that the heel aligns with the edge of the cuff for the best fit. Next, place the foot cuff around the foot and attach the hook securely to the cuff. The cuff should fit snugly but not too tight. Next, bring the comfort heel strap around the ankle and secure to the foot cuff. Plug the white cuff connector into the mating connector on the tube leading to the controller. Make sure the tubing is not kinked or twisted. Please note that this cuff connector is only compatible with the SCD Express controller and SCD Express tubing sets number 9528 and 9595. Finally, ensure the tubing is attached correctly to the SCD Express controller and turn the controller to the on position. Push the indicator buttons to activate foot compression. Contraindications for pneumatic compression include local leg conditions that are listed here and on the sleeve insert. When applied correctly, the SCD Express compression system provides safe, effective protection for patients who are at moderate, high, and highest risk of deep vein thrombosis, a common but preventable cause of death in the hospital. Used in conjunction with the other proven modalities, such as the TED anti-embolism stockings and anticoagulants, the SCD Express compression system provides an effective program of protection that meets current standards of care. Your Kendall vascular therapy specialist has the information and resources necessary to help you provide the best care possible for your patients.